There we
Hello,
go.
what's up, everybody?
Good morning. Glad to have you on here. Monday morning, first day of February.
That's right. First live video we've done in a while, too.
Yeah, it has been. So we had a couple days where, obviously, last Monday was a snow day for everyone, and then with Jake kind of getting stuff ready for his room, like we've had some transition with things. We wanted to come back and give you some more live video and some more education. Hello again. I'm Chris. Physical therapist, EHS Physical Therapy, and
Jake with Essential Motion Spine and Sport.
Yep.
And today we're talking about why you guys should come see us, because you may not know who we are, or a lot of you on here, you may know who we are.
Yes, thank you for those actually watching right now.
Yeah.
But we appreciate that, and
So
that is a good question. We want people to ask themselves, and they should actually ask themselves that wherever they go.
Oh,
like,
definitely.
why am I going here? Why would I choose this location over this location over this location? And it shouldn't just be because let's say a physician or somebody told them to go to some place. Like, actually do your
It's your choice.
homework.
Yeah.
Yes, ask people, ask friends where they've had good experiences at, and actually ask yourself, like, what do I want to get out of this? Like, where am I going to feel have the best fit, and where am I actually going to feel like I have a good outcome? Like, what is this place going to do for me? So here's why you either should not come here, or come here. Like,
right.
if it's not what
We're not for everyone.
No,
but-
if it's not what you're wanting, then don't.
Yeah.
And if it is what you think that is best for you, then please do give us that opportunity to help you. But why don't we go into some of the things, some of our core,
Sure.
like I'm going to call them core beliefs or tenets.
Okay.
As we believe in this, this, and this. Here's,
Right.
And Darlene, our location is in Elkhorn, Nebraska. Just to answer that quick question there.
Probably one of the biggest things that makes us different from most places is, at least in Elkhorn area, we're the only clinic that has chiropractors, physical therapy, and massage therapy all in one location. So I think that's a big unique point that we should talk about, because obviously our idea is that a U.S. patient seeing both chiropractic and physical therapy or massage, it all goes hand in hand and plays into a better outcome, in our opinion. So
Yeah, the multidisciplinary approach is something that we believe in. I mean,
Yeah.
people go to different, they go to the three, for our situation we have, genres or clinicians separately a lot of times. Oh, I've gone to PT, or I did the PT and it didn't work, or I went to chiropractic and it was okay, a temporary relief. They had me in and out in 5 minutes, crack them and get out. Or, I like my massage every once in a while, but again, just kind of a temporary, it feels good while I do it, but then, I don't know what to do after that. And the reason we do all three together, and not everyone gets all three, but we do believe in the combination of doing these things together.
Absolutely.
So that's, it's let's talk about what would someone would see when they'd come in on a chiropractic, and PT side, why we would do that together.
Yeah, so all the benefit, we see musculoskeletal pain, so muscles, joints, tendons, that's what we see the most of. Back, shoulders, we've seen a lot of shoulders lately. Regardless, all the research shows that, we can get in there and really work on things on the chiropractic side with our manual therapy, our adjusting, and then our muscle work. But then on the PT side,
Early intervention. I mean,
early intervention.
There's definitely good,
Yeah.
Research for certain conditions.
Sure.
Right. Especially in the spine, but extremities as well.
Yeah.
To get that manipulation, that movement in the joint, because it feels better. The body likes that. But then, most people then also need a plan, like you're going to go into, like, okay, now what do I do?
Exercise is where we need to push people towards, because that's where you make the most long-term goals. So I think that's where combining chiropractic and physical therapy, and then pushing towards a more fitness and active lifestyle after that, that's where you can see some really good results.
That leads me into then, and I'll ask Catherine, I'll answer your question here too, or I'll reach out to you personally, because we've talked before and we worked on things before. So I will get to you exactly, because we can help people even though they don't live here.
Sure. Yeah. Video call or whatever.
There are ways that we do that on a more virtual basis. Now, does it work, better if we're here in person? Yes, because there's certain things that we do that do take our skills, as far as, especially with chiropractic at Jake's side, manual things, and there's certain things that I would like to do with in person. But that is not to say that there's not some value in still coaching and guidance, to guide people along. But the fitness part is what I was going to get at real quick, is that many places, and if you've been to physical therapy in the past, it's like, well, your insurance covers, the same with chiropractic.
Yep.
Your insurance covers these 8, 10 visits. And then once you're like, well, you're feeling better, because they only measure pain. Maybe they might measure one other metric, like, well, your arm's moving, further now, so you're good. Like, you've got your benefits, so now you're done. But you're still feeling like, well, I feel a little better, but I don't know what to do yet. I don't know. I want to return to, fitness in the gym. I want to return to these things, throwing a ball, picking things up, pushing things, all these activities. But no one showed me how to do that. They've just only, I feel a little better. So again, another thing that would separate us, or that's different. If you want that, that's fine. If you want to feel like, pain is only really a minor
secondary
issue.
That's
not what we focus on. This does help you feel better, but who cares? You can actually control pain with drugs. I mean, you can take a drug and your brain won't feel the pain, but does it help you? Temporarily, but it's still not getting you back to doing. It's not building your confidence back up. It's not building your strength back up. You still don't have you still have that fear of doing things and injuring yourself. Where we'll take you from that phase and then go through, rebuilding, remodeling, and then get you onto, more of that custom fitness workout plans with guidance from us. So you can, okay, now you're ready for this. Now you're ready for this, and just keep on moving up. Now a lot of that will be on your own. I mean, you don't have to come in here to do that, but at least you have the feeling of the guidance of I'm not scared to do that stuff on my own. I have someone that's going to kind of look after me and show me what to do. Or some of the other ones that you had written down.
We got a little list here. So another thing we don't do is we don't sign people up for like lifetime treatment plans. I know on the chiropractic side we get a bad rap for that, for people wanting to see you 3 times a week for the rest of your life. And that's not our goal here.
Mark says this must be towards Jake here, so that's why you both have such great guns. Look at that. So Jake's gonna bust the sleeves out of those things.
Right.
Sun's out, guns out on those days right there. Yeah.
But we don't sign people up for long-term treatment plans.
Oh,
we like to get people better quick and then get them back to whatever their goal or activity is. So we don't want to see you every day for the rest of your life. We want you to give you the tools to self-manage on your own and be confident with whatever you're trying to get back to.
That's the key. When you can empower someone to be responsible for their own care, right?
Yep.
Now, so that's another thing. We don't want people that want to only rely on someone to do something to them, like do that thing to me so I feel better, and then I'll But no, that's part of it. But that doesn't get you what you really need. I mean, we could we want you to be responsible for your own care, feeling like, okay, I know what to do. I have to now do these things at home. For long-term fitness, that's what we're definitely looking for. And then let's just real quick, Darlene had a question on an exercise to help with hips at night. My left hip aches at night down to the knee. Okay.
Low back is proven otherwise.
Yes. So what we would have to do first is we'd have to at least assess that and see if the pain that you're getting from the hip down to the knee is most likely coming from the lower back. There's just not a lot of other structures that connect from the hip to the knee. I mean, there is a muscle on the outside, but typically that's not sleeping at night. You're not even loading it. You're not moving on it, walking on it. Especially if it's pretty consistent like that and it's to one side. More than likely would be coming from it's a referred symptom from the low back.
Yep.
But that would it doesn't take long, but that would take a little bit of us at least assessing, moving you around, bending, bending forwards, bending to the side, twisting, like moving, and then seeing, okay, what is the mechanical cause and effect of doing those actions, those movements? What does it do to your leg pain? If it changes it, which most will, then we're on this path. If it doesn't, then we're on this path. I mean, we just have to go through and set you on figure out what it is first, and then we can show you how to fix it.
Exactly.
And I know I'll answer Catherine's stuff here too. So numbness out of my foot when all the pain is out of the leg, and Catherine had a long-standing low back injury from the disc. I know she has a disc injury. She had an injection, which helped calm some things down.
Good.
But she actually spent some time in the hospital. It was bad. I mean, down the leg, bad. It's been bad for a while. Now the pain is less, but there's still numbness. So that's probably a residual. The numbness and tingling can last for a while. When the nerve has been damaged, you can get the pain to centralize. Pain is a much more reliable and fast indicator of better and worse. Down the leg, worse. Up the leg, better. But sometimes the numbness and tingling and other types of sensations can last a lot longer afterwards because of the damage to the nerve. Nerves heal very slowly.
They do.
So I'll reach out to her.
But they heal.
Yeah, they do. Yeah.
Another thing we do is going on with the no long-term treatment plans is we individualize our care plans. So you're not coming in and getting some cookie cutter treatment. We're tailoring our treatment specifically to you, your needs, and your goals. And a lot of times you see these, rack 'em and crack 'em clinics or E-stim heat and send you out the door.
Yeah, that's the thing. That's their therapies, right? Yeah, we're gonna do our therapy with it. What'd you do at your other place? Well, they put a hot pack on me and they put these little pads on me, and okay, that kind of feels good temporarily, but what does that do? I mean, the efficacy is just not there for long-term reasons as to why we would do that. In fact, we don't even have much for modalities here.
No,
I got a couple ice packs if something's really sore after, we do see some post-surgical things that we need some ice, but I mean, we don't have really a lot of the machines that, a lot of that because it's just not what we do. We're much more movement-based, again, teaching you, empowering you, making sure you know what to do to help yourself, rather than just passively make you just just put this on here and just sit there and rest. And yeah, it does feel better for a little while, but then what do you do when you go home? You don't have a plan.
Cool. And then on top of that, going on with that same idea, we do longer appointment times. So we're not getting you in and out in 5-10 minutes. We're seeing you for on the chiro side 20 to 30 minutes, and on your side sometimes up to an hour.
Sometimes an hour, 30 minutes to an hour.
Yeah.
So that's why again people don't come here if you're used to or really like the in and out guarantee. I've actually talked to a chiropractor that had a clinic that they were guaranteeing you from front door, from in the door to out the door in less than 10 or 15 minutes.
Yeah, that's not.
And so that's just not what we do. If that's what you like, please, that's fine. It's just not how we don't feel you're going to get, the most effective. Now, is it effective? Can you get benefits out of that? Yes.
Oh, sure, absolutely.
Yes.
Yeah.
But we just believe that a more effective treatment would be, having a longer term, more things that we're doing with, like I said, with soft tissue things and obviously the specific manipulations to the joints, mobilizations, therapeutic exercise, therapeutic activities. We want to get you to the not just temporary pain relief. That is fine, but it doesn't mean anything if you can't do the things you need to do.
Yeah, we don't want to change it more permanently.
Yep. So
another thing we can discuss here is between both of us and our different trainings and experiences, we've got a wide variety of tools to work on you with. So if you're a hammer, everything you see is a nail. Well, we've got a whole bunch of different tools that we can use. If you need a screwdriver, we've got a screwdriver. If you need a wrench, we've got a wrench.
Yep.
So we can
we'll get you to what you need too. I mean, it may not be with us. It may be we've had a couple people even just this last that said, had to go get surgery, had to go get this, and then they, come back because that's what they needed to get done to solve the problem. And thank you, Captain Bailiff, for watching. He said
Captain Bailiff.
Yep, Captain. He's out in warm Arizona. These guys don't just, these guys fix you. They don't just put Band-Aids. That's a good way to put it.
I like that.
Because that's what some, not all. I don't want to say it's bad. I'm not saying it's bad treatment at other places.
No.
Because you can get benefit, but we do feel like you get a better result with the combination of things, going deeper and the longer treatment times, rather than just maintenance Band-Aids of okay, I feel better, and then I got to come back and forever.
Nice.
Yeah.
I think we hit everything on my list. Did you have anything else you wanted?
No, I mean, it's what I just wanted. We wanted people to understand what they're
getting into,
expecting. Yeah. If you're hey, I want to go see these guys. I want to see Jake at Essential Motion. I want to see Chris with EHS Physical Therapy. We combine. We have our businesses together because we have mindset, similar path and goals of helping people, but we do it a slightly different way than what maybe you've been seen in the past or had done. And so we just want you to understand that, like any profession, there are some have better skills than others, some have worse skills than others. And so to say that, well, I've done the chiro, it didn't work. I've done the PT, that made me worse. They just hurt me every time. Well, maybe at that place, but it's the same thing as you can go to different dentists. If you don't like one, you go to a different one. You don't have to go back there. If it's oh, that hurt my tooth, I'm going to try somebody else. Same thing with your primary care providers, your physicians. I went to that place and all they wanted to do was just, give me injections or medication. But I go to someplace else and they listen to me better. They send me to the right. Okay, it's you have the choice. You can go wherever you want to. Keep trying places until you find the one that you feel comfortable with, and feel like you're getting the best result. Feel like you're getting heard and listened to, feel like you're getting your questions answered.
Yes, that's
right.
important.
Because we've known places that it's the script's the same. They call in every time they go in. Oh, how are you feeling? Okay, how was your weekend? Da da da. Crack, like that, and then out the door. It's like they didn't even really like understand or know, what's going on in the background.
Reassess.
Yeah, or reassess. It's just the same treatment every time. Because we've asked people, what do they do? Well, they crack this one, and then I'm out. And then I'm out.
Yep.
And they put a hot pack on me. Okay, where's the plan there? What's the progression of getting somebody back to what they want to do? I think that's what we wanted to get across. And we've probably taken up enough of your time. We appreciate everyone that hopped on, that watched. Leave questions. We'll go back. Jake and I will go back, and we'll type through this, and we'll answer your questions. Or can't talk. We will reach out to you specifically and answer your questions. We would love to do that. It's something that we are obviously extremely passionate about. Helping people in education and getting you the knowledge that you need to make better decisions, informed choices on these kind of things, on your care.
Yeah.
So,
all right, guys. Thank you. We'll see you.